someone in need of CPR. Remember from your e-learning?
See if they're responsive.
Almost. Something before that. Something about your environment.
Oh, make sure it's safe.
That's right.
Yeah.
Make sure the scene is safe. So for class purposes, in real life you won't be going like this. But just so I know, you think about your safety. Scene is safe. Kind of look around. The reason for that, like they said in the training, is because we don't want you to get hurt. Because if you get hurt, you can't help anybody else.
Yeah.
So we're making sure there's no live wires, no, nothing sketchy going on. Like, okay, scene is safe. Whatever took them out isn't going to take me out, pretty much. So scene is safe. Then, like you said, you can check for responsiveness. Are you okay? And then I always teach palms up in case there is if there's any electrical current nearby, that shock will bounce off your hands. If you wake them up like this, you could get shocked.
Yeah.
So that's just how I've always been taught. Whatever way you want to do is up to you. This is ingrained in my brain. So, are you
Can you say
okay?
that again with the?
So if they're in any sort of situation where they can conduct electricity, there's a live wire nearby that you didn't see, you wake them up like this, your hands will bounce off.
Oh.
But if you go like this, that contact will shock you.
Okay, good. That's good.
Like I said, it's pretty rare that would be the case, but
yeah,
1 in a million, right? So
right.
that's
That's
why I
good
always
to
say,
know. That
Are
is.
you okay? And you want to be loud. So you can practice being loud in here. We don't mind. We warned them all. We're doing CPR. So, hey, are you okay? That's how we check for responsiveness. And in my classes, I like to practice real life because, that's how you're going to remember it, right? Mm-hmm. So that's why I have them put shirts on the mannequins because it's unlikely you're going to be at the beach and they're going to be half naked already. So I put shirts on them and we're going to be loud. It helps people learn, helps make it more realistic. So scene is safe. Check it for responsiveness. Are you okay? No response. What do you do next?
It was
He's not looking good.
yeah. I think you start with the CPR, right?
Almost. That's
That's
okay. The first 4 steps, they teach them in an order, but in real life, as long as you're getting them all, you're good. We just had to put them in some kind of order. So checking the scene is safe. Are you okay? Checking for responsiveness, and then check for breathing. Because breathing, if they're not responding, you still gotta get them help. But if they're not breathing, then you need to, you need to do something. So, So if they're not responding, call 911, get an AED, and then check for breathing. So, forget that. No. So we're scene is safe. Are you okay? Are you okay? They're not responding. Hey, you, can you call 911 and get an AED? And then we check for breathing while they're running to call 911. So you can ask somebody else to do that. So it's scene is safe, checking for responsiveness. You call 911 because they didn't respond, so someone's got to go call 911. But you should direct that to somebody else because you're going to be checking for breathing and doing CPR. If you're by yourself, that's when you give them on speakerphone.
Okay.
Because if they're not responding, we know we need help of some kind. So yes, scene is safe, check for responsiveness, call 911 and get an AED. Both of those things, 911 AED, which is this thing. And then check for breathing. Yeah. And then I like to say to myself, do I see a breath? Real slow. If you talk fast, say it twice because they want you to check for 5 to 10 seconds. Because if someone's in distress, it's going to take them longer to breathe, even normally. So you can look at the chest, look for a rise and fall. People have asked, like, oh, do you feel for a breath? No, just see if their chest is going up and down.
You said 10 seconds?
5 to 10 seconds, yep. And then, do I see a breath? Nope. Not responding, not breathing. Someone's already calling 911. So now I'm going to bare the chest and start compressions. So do you want to review those first ones again? I know it's a lot I'm throwing at you. So however you learn best, you let me know. What's the first thing you do?
It was make sure the scene is safe.
That's right. Yep. Scene is safe.
And then you check responsible.
Yep, show me. Go ahead.
You okay?
There you go. Perfect.
Okay.
See, you're a natural. See, safe, check.
911. If
Yep.
you call 911, get an AED.
Mm-hmm.
Check and see if they're breathing.
That's right.
But
How long?
after that, wasn't it? Oh,
You're right. No, you're
you
right.
said 5. You say 5 to 10.
Yeah, yep, 5 to 10 seconds. Yep.
But on the video, they show like open up airways if you didn't see.
Yeah. Well,
Like,
and
well, tilt it back.
yep, and so when we give breaths, we're gonna tilt their
Okay.
head, and then we'll talk about choking too. If they're choking, then you'll add a couple steps. But checking for breathing, we're just looking for that rise and fall to make sure we need to do CPR. But yeah,
But if it's not, then you
yep. And then we're gonna start with compression, so you can bare the chest. So these guys, they have fancy indicator lights on them, so you can just move that shirt up to their neck, because that's usually the quickest. And the lights are going to be right on their shoulder. Perfect. And you want the heel of your hand right in their chest there. There you go. And you can either lace your fingers or like this. I have arthritis in my wrists a bit, so I tend to go like this. As long as the heel of your hand is there.
Whose pen is this?
That's mine.
Okay, yeah, I'm gonna
I stole it from work, so it's fine. You feel that? That spring? Did you get green lights in your corner? Oh, let's switch your guy around so I can see. Let me move his head. Sorry.
We're looking
There
for
you
green
go.
lights.
Yep, we're looking for 2 green lights. So try that again. 1, 2. Let's go a little faster. 1, 2, 3, 4, 5, 6, 7. There you go. 2 green lights. There. Perfect.
The instructor, he gave us 2 songs. He gave us "Staying Alive" by the Bee Gees,
Uh-huh.
and then he gave us another one by Stardust by Queen.
Oh yeah, yeah. There's a whole playlist. If you look on, Spotify or what, CPR playlist, they got you covered. There's a ton of songs because you want those 30 compressions to be between 15 and 30 seconds.
You a little young, you know what I'm talking about, the Bee Gees and Queen,
There'd be a lot of songs I can hear every day.
Uh-huh.
Yeah.
Yep.
or another one by Stardust.
Mm-hmm.
Okay, you know what I'm
Yeah.
talking about. Okay.
So if you get 2 green lights, it means your depth is good. So 1 green light is you've got good depth. 2nd green light is you've got good speed. There you go. Perfect. And how many compressions do we do?
30.
That's right.
And
So how am I going to know if you're doing 30? You got to count out loud for me.
yeah.
Yep. So even in real life, I know it seems kind of funny, but you want to count out loud because if someone else is coming up and they know CPR, they're like, oh, he's almost done with his compressions. Hey, I can
Somebody
help
take
you
over.
and switch,
So y'all mind
you
if I
wanna-
do the floor?
No, I don't mind.
Because this table is not tabling.
I know. I have to stand on my tiptoes in my boots.
Because we're about the same height.
Uh-huh.
Well, the boots.
I know. I'm cheating. That's a nice rug.
Isn't it?
That's cute.
And we have a few of these.
Look
Yes.
at that.
Because, I thought it was going to be the rugs from kindergarten. But
Right. We bought gardening knee pads for CPR, so
Oh,
maybe we can look into that.
okay.
So the 30 compressions, let's count out loud.
Oh, yeah, this works so much
So we'll
better.
go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Ooh, child. Yeah, this is a whole lot better for me.
Good,
Yeah.
good. And you can put your whole
Mhm.
body weight into it,
Awesome.
Good.
Everybody ain't tall and long
30.
and able.
Excellent.
Terrence.
Any questions? That was great.
Mhm.
2 green lights, perfect. And these are real fussy. If it's not quite quick enough, you'll see it flash a little, but it's great practice.
Okay.
So 30 compressions, great. You had great hand placement, good speed, and then masks. So we do 30 compressions. We always start with compressions.
Okay.
And if you don't have a mask, we don't do breaths.
Okay.
You don't?
Nope. And that's a rule at work. As a lot of places in the medical field, if you don't have a mask, you don't get breaths. You don't know what they got. They don't know what you got.
Exactly. Oh, I'm so glad
Especially
you said
in COVID, if you don't have no mask, we don't get breaths.
that. Okay.
And honestly, statistically, it's the compressions and the AED that's going to save their life. American Heart Association found out a long time ago that breaths were nice when you had a one-way valve, but they were the end all be all.
Even with drowning?
Even with drowning, because that compression is gonna pump it out. But that being said, they have these masks. They have AEDs have masks in them, and then there are a lot of keychain masks that I have one in my work purse, my work bag. It's like a little keychain. It's got a one-time use mask in it. They're like $2 on Amazon.
Yeah, I got one of these.
Yeah. So you put this.
Some in my car.
You put this over their mouth, and you have to pinch their nose with these, and then you tip up their chin. Then your whole mouth goes over this one-way valve, and you blow into it. So this is just an example, but this is what those look like. The only difference is you gotta plug their nose and hold this down while you're tipping up their chin.
And these supposed to come with
Yep.
like these, right?
Yes. A lot of them do. Some
I
of
don't
them.
know.
I don't recall
Yours-
seeing it out in the field either. Is that what you're saying?
Yeah.
Okay.
So like yours, and I only know because I was snooping around and found these. That's the old ones. Yours comes with this, so it's very similar to this one. They don't all pop open like that. So yeah, I haven't, but it's in this little thing. It's like a plastic one.
You said those are old ones.
These are old packs for training. This plugs in. These plug into, like different AEDs. This one has some inside. So depending on what style AED you have, it either plugs in, and then you can stick the pads on, or they're already attached like this.
Okay.
Do we have this style? Is this?
We can go look.
Okay. So I didn't.
Yeah.
Yeah. I don't. They don't come in the thing like that.
Okay.
I didn't
What's
know
the
that-
thing?
In this little pouch.
Box.
There
Yeah.
you go. You know how much they work.
Yeah. Yeah. So you
But I
can.
didn't know these lift open like that.
Yep. And they're all different. Like even our training AEDs in Minnesota look different than that. So, but all of them are really similar. They got same two pads, they got the same instructions, so just listen to what it tells you and you're good.
I don't recall which ones are in the field, or is it either one of these?
It's both.
Okay.
Yeah.
These, oh, nice, perfect. Some of them, as soon as you open them, they start talking to you. Some of them you have to turn on.
Okay.
We'll get to the AED part, but
Okay.
a lot of them come with some sort of face shield. The pads do, or in the AED bin, something like this. So as long as you have a one-way valve, either like this or this, you can do breaths.
Yeah.
So we're gonna practice with breaths because we got a mask. You don't have to stick it on their face. I usually don't bother because the ones we have in Minnesota don't have a thing. So if you have one, that's great because then you can just leave it on. But if you don't have a strap, don't worry about it. So we'll put it over the skinny. Yep, you got it just right.
Can you? Cause it
You throwing stuff around with
it's
crystals?
way over there. Thank you.
There you go. So with breaths, yep, you got it on right, and you're gonna tip up the chin and then push down on the harder plastic. You want to get a good seal so that none of the air is escaping. So you want to lift up their chin, get a good breath, and then blow in.
You said two?
There we go.
What is that?
Yep. So lift up their chin, yep, and then push down on the top part. Mine was kind of leaking out the nose until I pushed down real hard on it. I can hear it. So honestly with this thing, I just slap it on and there you go. So really push down on that mask and then blow. Yeah, it could be your mannequin. Here, we'll switch mannequins because this guy I know is working. You can keep your mask, but we'll switch bodies. No. We just put these masks in yesterday, the new lungs in yesterday, so. I know that, guys. And as you're giving these breaths, you should be looking at your patient and making sure the chest is raising up. Now, typically, you don't need to give like a pufferfish breath. Oh, there you go. So you just want to give a nice normal breath, like just a regular breath. it shouldn't take much.
I didn't see mine rising.
There you
y'all.
They're perfect, just like that. That was perfect. See, just a little rise in the chest,
Yeah.
because if you blow them up like a pufferfish, they are gonna vomit all over
Oh
you.
no.
And that is not considered responsiveness. Just because they're puking doesn't mean they're waking up. But when you're blowing that much air in there.
You see my chest rising? You did? I don't either.
I don't think that both. I
Oh,
don't think that both. I don't see.
right? I can feel it coming out of his face. That's annoying.
You probably gotta get
I
no
don't
breast,
see it.
homeboy.
Alright.
Just get
Well,
compressions.
we're gonna look at these,
Oh, this
Crystal,
one.
because,
Okay.
yeah.
Okay.
That's so weird.
Do you
We'll
think
look at these,
maybe
'cause I-
if we try to use those bigger
Might not
mannequins,
fit.
they might be better for the breasts? I don't know.
Yeah,
Okay.
we can look into them because something about like the mask, because I can feel it coming out of the eyes.
Right.
The mask isn't fitting nicely
Yeah.
Come
on
on, the
these
eyes.
ones. Yeah, well, like the nose here, like,
Oh, okay.
yeah. Let me try one of these. Are the kind we use in Minnesota, Crystal. Like just these trainer ones, so it looks like that.
Okay.
And we wash them in bleach and reuse them, but
Those are smaller too,
yeah, it might be the mannequins.
huh?
Like I said, we
This one works.
yeah, that one works. So
Okay.
we'll check on these, but you get the idea. So if there's a mask, great.
Okay.
So then we do
no
30
breasts.
compressions, 2 breaths. Now usually I tell people to take the mask off when you're doing compressions, so don't roll away. But if you have one with straps on it, keep that on there. You know, because it's gonna stay. So that's good to know. But keep it near you. Because time is huge with CPR. Like, you know, the quicker you can assess the situation and start compressions, the more of a chance they're gonna have of surviving. So let's put the 2 together. Let's do our 30 compressions and 2 breaths.
Okay.
Okay, and I want to hear y'all count out loud too. Okay, ready?
Mhm.
Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, 2 breaths. All right. Oh, yours is good enough. All right. So if your first breath doesn't go through, do you remember what to do?
Oh yeah, push it.
Tilt the chin.
So if your first breath doesn't go through,
Mm-hmm.
you're like, oh dang. You put the chin down and then back up.
Okay.
And then try your second breath. There you go. Perfect. You know, if your second...
it working at all?
Mm-mm. I think it's the mannequins because we'll look at the lungs again and see.
Okay.
But if your second breath doesn't go through, we go right back to compressions.
Okay.
You know, if the first one don't work, try again, like reposition, do your second breath. If second breath doesn't go through, right back to compressions. Because we don't want the breaths to take any longer than 10 seconds. Because we don't want to interrupt compressions for more than 10 seconds unless they're on an AED.
Okay.
Does that make sense?
Yes.
So like, all right, you get one redo, and then if that doesn't work, we're moving on.
Because the compressions are the most important thing
Yep.
to keep them
Exactly.
alive. Okay.
Exactly. So, first breath doesn't work, reset, try your second, move on, whether or not it works.
Okay.
Ideally, you're sitting like this and you're doing 2 breaths without having to move. If it's working, ours is giving us a hard time. But yours looks great. So, compressions, breaths. Any questions about those?
No.
Okay.
I
Looks
gotta
like you got it
remember-
down already. Yeah. Lifting the chin. Well, and because, like, if they're laying down, it kind of cuts off, you know, their soft palate there. It cuts off their airways. So you got to open that up. The only difference we would do if we knew somebody was choking, like we're at a restaurant or something and we see them, is check their mouth for any obstructions before we give breaths. And if you see something, you can take it out, but we never just blindly stick our finger in there. One, it's gross, and two, you don't want to push it further in.
So, you know, with the choking, right? Back in the day, they did the swoop. What are they doing now?
Now we're looking for anything, and if we don't see anything, we do the breaths and the compressions like normal. But if you see something, you can pull it out.
Just pull.
Yeah.
Okay, no sweep, pull.
No sweep, yeah, because the sweep they found was just as likely to shove it further down if they're not seeing nothing.
Okay.
So,
That makes sense.
and then like I said earlier, if you're sometimes when you're doing CPR, you're hauling on their chest, you're you're blowing up with air, they can vomit is a common thing to happen. And then if that happens, you want to roll them into the recovery position, which is towards you. It's the yucky way. So if they're puking, we're going to move the mask out of their face and roll them towards you. One, because then you can see when they're done, right? And then you check for response. They're done. Hey, are you okay? Still not responding. I'm going to go back to my CPR. Starting with compressions.
So what was the other one where you roll them over?
And then you roll them towards you because if you roll them away, oh, there they go, then they're on their face. Whereas your body can stop them, especially if they're bigger than you, you can stop them with yourself, so they don't land on their face. So that's the recovery position is towards you.
Okay.
So watch out for your shoes, but it happens. And like I said, you're still going to look for responsiveness after that because puking is not responsiveness.
Okay.
And nope, still not doing good. It could be these. This might be the ones. We'll figure it out. But that's that. So let's start from the top. Remember our starting steps. Those are honestly the trickiest for people to remember because it's like, I know I got to do all this, but what order did we say?
Would you like me to do it with y'all, the steps?
Yeah, sure.
Okay, cool.
Especially if it helps you remember.
Yeah.
For sure. All right. What's the first thing we're gonna do?
Check
For
for
safety.
responsibility.
Right.
Safety.
Oh, yes,
Safety.
scene. Thank you.
See? Yep,
Okay.
yep.
Check
Okay,
scene.
scene is safe.
Everything's
We're good. All right. Then what's next, Crystal?
Hey, are you okay?
Yep.
Are you
All right.
okay?
Are you okay? Are you okay?
Are you okay?
It's not respond. What next, Terrence?
You asked want to call 911.
That's right.
See if they have a-
Okay.
I'll do
So-
it. I'll get the AED. So
Okay.
call and get an AED.
Call the police. I mean,
Oh, no. There you go.
Call
hey.
call now.
They'll get it. Yeah, that works.
Okay, call 911, get the AED.
Yep. So while they're doing that, what are we gonna do?
We're going to check for breathing.
Yeah.
See if it rises with the chest, and then get to it.
Yep. And
Well, look,
Terrence,
for
how
5 to
long
10.
are we? That's right, 5 to 10 seconds. You read my mind. All right. I don't see any breathing. Where are we gonna start?
CPR.
CPR.
That's right. Okay. I want to hear you
2,
counting.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right. Do your breaths. All right. And then what's next? We
Get
let
back
them
to
die? Nope. Compressions. Go, go, go. There you go.
3, 4, 5, 6, 7, 8, 9,
Perfect.
10,
Nice
11,
life,
12,
Crystal.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right. Let's do those breaths. Perfect. All right. You can take a break. Good. So that was great. A nice workout today. So, American Heart Association says you should be able to do this for 2 minutes at a time. That was just 1 minute.
All right.
So, you should be able to do 4 rounds of CPR before swapping with somebody. Now, the
4
more
rounds of
tired you get, the shallower your compressions are going to be, and you're going to slow down because we're human, right? We don't do this on a daily basis, hopefully.
4 rounds of CPR.
So, if people err on the side of slightly faster, I'm okay with that.
Okay.
Because you're going to naturally slow down with your compressions.
Okay.
But you guys had perfect timing, great breaths. Your mannequin's lovely. We'll test them out before tomorrow's class. But
Okay.
that
I
was great.
wonder if that was the mannequin I had in class.
Maybe.
you know, because I could not get it right.
Yeah. It could be. We'll look at ordering new ones if need be.
You want to switch managers?
Yeah, that's
Let's do
fine.
that.
I couldn't get breasts on this guy either. So
Okay.
good luck.
Thank you.
Mm-hmm. See what you can do with him.
Okay.
Yeah, we can switch out the lungs again too. If it has a hole in it, then it doesn't work. But
Okay.
so that was great. Great beginning steps, good compressions, nice quick breaths. That was awesome. Those were less than 5 seconds in between.
Okay.
So whenever someone arrives with the AED, we're gonna use it immediately. No matter you're on breath number 1, compression number 12, doesn't matter. This is super important. So we're gonna turn this one on. Oops, sorry.
It's okay.
Mine are attached at home. So, and it shows, you can use this as like a prop to lift up their head.
Okay.
So you can use this
Wow.
their shirts in the way. You can do this and it helps. But
Wow,
I'd
I
be
did not know
careful.
that.
I'd be careful with that because if they have a neck injury or a spine injury, like keep that in mind. If you don't know how they got there, be cautious with this. So we turn it on. And we're like, okay, what do we do? And then you hit the power button again.
Unit okay.
And then it starts talking to me.
Stay
Okay,
calm. Check
stay
responsiveness.
calm.
Call for help.
Now this thing,
Attach defib pads to patient's bare chest.
it's got a nice handy picture for you. So, there's no
Attach defib pads to patient's bare chest.
These are real sticky, but we're gonna use these. Okay, I'm gonna line it up.
Attach defib pads to patient's bare chest.
Stick them on there. Here we go. And then the real ones are gonna
Attach
stick.
defib pads to patient's bare chest.
Mandy, what is that?
Attach defib pads to patient's bare chest.
Oh, it has a remote control?
Yes.
Well,
Enter.
savvy. Does that require batteries?
Mm-hmm.
What
Attach
size?
defib
I got
pads
some
to
in my
patient's
desk,
bare
but I
chest.
don't know what size.
Sorry.
No, it's okay.
Don't touch patient.
There we go.
Analyzing.
This button is what you want.
May I see it again?
This one. So at this
Don't
point, you
touch
say
patient.
clear. Don't
Analyze
touch the patient.
This one?
This one, I think. We'll try.
Shock advised.
Okay.
Don't touch patient.
Before
Press
you hit the
flashing
shock
shock
button,
button.
make sure you say clear.
Shock delivered. Start CPR.
And you're gonna do it right over. So I'm gonna turn this up because it's driving me crazy. All right, couple things with this. Now that I figured out how to use a remote, my bad.
I didn't know that one.
Ours have a remote too. Normally, it can tell when these are sticking to your person. You know, like this will be super sticky and it'll attach perfectly. This one, the sticky thing pulled off of that, and it was, these are training AEDs. They've been loved and used a lot. So normally it can tell when it's sticking.
Okay.
I pulled this off too quickly, but it's all right. The real ones are very sticky in real life.
Okay.
This one, like I said, the trainer ones, as long as you're getting the idea, I'm not gonna pull that off. But you peel these off and then it's super, super sticky.
So,
And it can sense when it's stuck to the person. That's why I kept saying, apply the pads. I'm like, I have them on, but I couldn't tell that it was attached until I hit the remote control button. But
So, out when this is happening live, right?
Mhm.
If I have someone, and I guess it's my question.
mm-hmm.
How does one know when they are doing this live that the compressions are effective? I mean, we know with the rising of the chest with the
Right.
breaths, but how with the compressions?
Well, it's about 2 inches.
Mm-hmm.
Well, it is 2 inches. Like you'll get your double green lights if it's 2 inches and you have the right pace.
Mm-hmm.
You'll notice this started beeping.
Right.
That was on the very slowest end of the range. So I went a little faster than that because I knew, like, okay, that seems real slow. I'm going to think of those songs. I'm going to think of my pacing.
Okay.
And I went a little ahead of this, but it gives you a good idea.
Okay.
Most AEDs will count for you, so
Okay.
that's nice. But in your head, you're counting out loud to the 30. And that 2 inches, that's why we practice with these, so you kind of know what that feels like.
Okay.
It's not easy.
It's not.
So if it feels like it's, you know, a lot of work, you're probably doing it right.
I think for me, I'm just afraid that I'll go out there, right, and I will. Cause I did CPR. I've done CPR a couple of times live, right, and I've actually heard bones break, and I was mortified. So I guess that's why I'm asking that question. Like, I don't know if I know the person was old, and that could have been why it happened, but I guess for me, when I look back on it with my bonnet on, I wonder how could I tell myself if I am in the right place. I mean, I know in class
The
we're
sternum,
shown.
Yep, the sternum.
Mhm.
So, yep, right between the,
Is that right there?
yep,
Yeah.
yeah, like right between the breastbone, right on the breastbone. And here, they said it's good placement, like right in between,
So
right in the center.
when
you can
I'm-
kind of feel your sternum.
okay, so when I'm thrusting, I'm gonna be feeling that. I mean, I believe
It's
it.
about 2 inches. And normally, like the first time we were teaching a CPR class in Minnesota, our MD, our Dr. Gorlin, he came in and he told the class, "You're not breaking ribs. You're not doing it right." And, yeah, he was a character.
Oh,
But
okay. Is that
it's,
true?
It's pretty common.
Oh my
It's very
God.
common.
I was
because,
so mortified.
You know.
I was okay.
Mhm.
So I guess I probably was doing it right, but I was like, he survived. He did for
Yeah.
a little bit.
Right,
Yeah. Okay.
So that does happen. It doesn't obviously feel like this because this is a spring. One of our volunteer coordinators had to give CPR 3 times in his life. One was a neighbor, one was a random guy on the golf course. But, you know, just circumstantially, it was bizarre. So we kept renewing his CPR because we were worried he'd have to do it again. just
I've
because
done
of
it
the rules.
twice. In a dialysis setting and in a hospital, and the man was big in a hospital.
Mhm.
And he was like a, I hate to say a returning patient. You know, he
Yeah.
was like he came often, and he was non-compliant to everything. He would play, he'll fake and
Oh,
you
my
know.
goodness.
So this one day, he was in the bed eating what he wanted to eat and stuff. I'm trying to clean up his room and stuff. I was really young, and he was like, "I'm going down." I'm like, you know what? I am not in the mood today.
Oh,
You
God.
know. And
Oh, no.
he actually went unresponsive
Oh,
on me.
my.
And he was so big
Mhm.
that I had to climb on top of him,
Mhm.
like this table,
Yeah.
and
Mhm.
get those started before, was it respiratory
Yeah,
therapy? They
yeah.
came up, but
Mhm.
it was a really weird position,
Yeah.
and I wasn't sure how effective it was because
Mhm.
this table reminds me of him. I'm trying to
Yeah.
get, over here.
Well, and as long as you can get in the, you watch any of those medical shows, and they got people on top of gurneys all the time. And,
Yeah.
in real life, you just do the best you can. You know, a lot of states have the, Good Samaritan laws where if you're certified, you're trying to save a life, they take that into account. And there's really no, great substitute for real CPR.
Mm-hmm.
This is as close as we get.
Yeah.
And so this is just to give you all the tools in case you're ever in that situation, but it doesn't feel quite like this. It's gonna sound different, but
I really
just
like
trust
this.
that you're doing it right.
I do. In dialysis they have those the treatment machines plugged up, so we had to make sure that there wasn't any electrical issues when we went down there. And unfortunately, us moving it, the bicart fluid
Right.
was on the floor, so we had to make sure we was safe before we did CPR on that guy. We had to take him out of the chair onto the floor. Yeah, it was
Yeah.
it was
That's
crazy.
a lot.
Mhm.
But this shows you nicely where to put it. Like put this in the middle where you're doing your CPR compressions. It shows here, it's got everything laid out. Different
Okay.
pads have different pictures on them, but it's showing you where to put it.
Okay.
You want to put it here, not opposite, because opposite won't work. Some of them, if the pads don't have a nice connector like this, the pads are exactly identical.
Okay.
So if these were separate and you accidentally put this one here and that one there, it's fine as long as it's on the correct side.
Okay.
So, again, follow your pictures. It's telling you what to do. If it says apply the pads, stick them on tighter
Okay.
or press your button on your remote. But it doesn't need much skin contact to trigger the AED into, it's gonna do, when you put the pads on, it's gonna analyze.
Okay.
So I wanna hear you say clear when it's analyzing, because if you're touching them, it'll interrupt that and it won't be able to pick up on that rhythm. And so you clear when it's analyzing, and then if it says shock advised, you gotta clear before you hit that shock button. And in fact, I need to move my stuff out of the way because you should have this over here so that you can hit the shock, oops, sorry.
It's alright.
So you can hit the shock button without having to lean over them like I did. Because if you accidentally touch them, you don't want to get a shock.
Yeah, that wouldn't be
It
good.
won't help you, but
Would it hurt us? Like, it wouldn't hurt. That's good.
it just wouldn't help them.
Okay.
Any questions about using the AED?
No.
Just what button to push on the remote.
Oh, right, I know. Sorry about that. I'm like, it wasn't the one I thought. It was this one. Oh yeah, this one
Oh.
for training.
Which
But
one? This one?
I'll push
So-
the button. So you just do this.
Okay.
Once you got it in the right spot, I'll move it along for you so you
Okay.
can experience it as real life as possible.
Okay.
But yeah, that was annoying. It didn't censor for me. So that's the training in EDs. I'm gonna order y'all some new pads because
Okay.
these are real sticking. So, good luck to you. No.
Thank you.
So we'll put this in here. We'll turn it off, and then you just keep going. Follow what the AED tells you, because sometimes it'll, after 2 minutes, it'll usually analyze again, but it won't always. So just listen to what it's telling you. It'll say 2 breaths. After it's done counting to 30, it'll say give 2 breaths. So you give 2 breaths, and then sometimes it'll say analyzing heart rhythm. Do not touch patient. Okay, clear everybody. Don't touch them.
Mm-hmm.
And then you just follow the prompts. Like
Okay.
shock advised, clear, and then hit your shock button. Got it?
I got it.
Okay,
No
so we'll practice. Don't worry. So we'll practice. Let you try it out with the AED and stuff. Put it all together. I'll let you try it all once through, and then if it feels good, we can do your final check off. Any questions?
No.
All right, perfect. We'll start at the very beginning with our steps.
Okay.
What do we do first? You can just show me. You don't have to read them out loud. Just show me what you would do.
Okay, you
sure
want to
things-
check the
Safety.
thing, make sure
Nope,
everything's...
not you.
Oh.
You passed yours.
Sorry.
Nope, that's
Make
okay.
sure-
Let Terrence try
I'm
it.
sorry,
No,
Terrence.
That's okay.
Make sure everything is safe and clear.
Yep.
Seen. And
Mhm.
then I check for responsiveness.
Yeah,
Like,
yeah.
Hey, are you okay?
Not looking good.
And then I'll call. I'll look and see you.
Mhm.
And hey, can you call 911 and they get an AED machine?
Yep. Yeah. I can do that.
Visually check and see if you can see breath for 5 to 10 seconds.
Perfect. He's not breathing.
If not, then I go to CPR.
That's right.
And then I do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, Terrence.
Nice.
Yeah.
Keep going. He's not live yet. All right, you can stop. Good. My point was just you gave 2 breaths and then we got to keep
Yeah,
going,
keep going.
and then it's just like
Okay.
muscle memory. Great, that was perfect.
Mandy, are
Look at
they,
that.
are they
Can't go past 10
required to do the
Right,
the
right.
whole 10 minutes in the 4 rounds, or do you?
No,
Okay.
no.
Okay.
Everyone would be exhausted and they hate me.
Okay.
I have, my CPR instructor said, it's good for people to do it for 2 minutes just to see how it feels.
Mhm.
So if, as you're practicing, like we did it two rounds earlier,
Mhm.
he did another 30 here, another 30 there. So by the end of the class, you'll have done it for those 2 minutes,
Okay.
combined. But if you feel like, it would be good practice, you can still have them do it for 2 minutes. But if you're the only one there,
Mhm.
you can go until you can't go no more, right?
Yeah, 'cause I
that's
was
why you
tired.
get
My hands
911
hurt.
on the phone, like
Yeah.
on speaker, and they'll walk you through CPR steps too. Like, hey, I'm giving
Okay.
CPR, I'm certified, but
That's good
send
to
help,
know.
right?
To make sure I tell them that
It'll help.
if no one's there to
Yep.
call the 911 and put them on speaker.
Mhm. All right, here's an AED, but I don't know how to use it. Good luck.
Wait, open.
Mhm.
Can I press
Yeah.
button?
Sometimes you gotta press it twice. I don't know why on these. There you go.
And I'll take the.
Yeah. I'm gonna press it again.
Unit
There we
okay.
go.
Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare
All
chest.
right, they look good.
Don't touch patient. Analyzing.
What do you say? Oh my gosh, Gerald! I don't know what his name is, but make sure you say clear.
Don't touch patient.
So that the
Analyzing.
crazy wife or somebody don't mess around with him.
So clear.
Shock
Mhm.
advised.
Perfect.
Don't touch patient. Press flashing shock button.
Good.
Shock delivered. Start
All
CPR.
right. There you go.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 27, 28, 29, 30.
That's okay. You're ahead of it, but that's fine. You can give your 2 breaths.
So the beeping, is that to help stay on point with
The
the...
counting, yeah.
Okay.
And if you can hear the beeping, you can follow the beeping. Depending on if you're in a crowded room, or you can turn it off. That's fine. Thanks. So depending on if you're in like a crowded area and you can't hear this, then you count.
Okay.
But otherwise, you can follow the beeping. It's doing the work for you.
Okay.
Yeah. Any questions with the AED? I know it's a little weird with all the pieces of it and.
So it don't come with a remote, does it?
No, it doesn't come
Okay.
with a remote.
Okay.
That's training only. Yeah.
That's what was confusing. Okay.
No, training. I try to hide it in my classes, like, woo, but the pads are so worn out that they don't work for nothing. In real life, those pads are real sticky, so make sure you're putting it in the right spot the first time, and then it'll sense when the pads are on and move on automatically. We'll order new pads just so it's a little more realistic, but you don't need much skin contact. But if you have a real hairy person, you know, you got either shave them, or if there's 2 sets of pads, you can take 1 set of pads and give them a quick wax job.
Okay. I think I've
They're
seen
not
that
responsive, so you know we're saving their life. So hopefully they won't mind. But that's worst case. But again, they don't need much skin contact for it to pick up on it.
Too. Okay.
If they came out of a pool, you don't need to dry them off completely, but maybe quick wipe down their chest with like your sleeve or something you have on you, just so that they can stick, you know?
Mm-hmm.
If they're in a puddle or snow, doesn't matter.
Okay.
It's fine. It's not gonna hurt them. If there is like a medicine patch or like a pacemaker, thank you. We want to avoid putting it directly over that, so then you're gonna put it as close as you can without putting it directly over the pacemaker.
Okay.
And it'll catch it.
Okay.
Trying to think of what else. That's pretty much it. Like I said, as soon as you get the AED, use it. Follow the instructions. They've all got photos, and they, you know, like I said, it'll keep telling you what to do. Yeah. That was great. Any questions? No? Should we put it all together one more time? You ready?
Yeah.
All right. Yeah, you're looking good. I think we got it. Let's put the pads away and put our shirt on, our gentleman.
All right, Terrence.
Woohoo!
Woohoo.
All right. So this, I like to give like turn it.
Unit okay.
Shh,
Unit okay.
I know. There. Okay. So I'll arrive with the AED at some point. I'll tell you. But usually for these, I like to come up with some sort of scenario.
Okay.
Just to make it a little more realistic, like whether you're grocery shopping or at a blood drive or at a donor center, wherever you think would be most helpful. And then at this point, we're using the checklist.
He gave us on the checklist. It has a scenario up here. Do you want us to do a different scenario besides this one?
Oh, it has one up there?
The other
Oh, the one
checklist, he
you
had like 3 different ones, but.
Oh, yeah.
Okay, so
That's fine.
should we use this or?
You can.
Okay,
Or you can paraphrase,
okay.
right? To
Cause
make
you know
it,
I can make
yeah,
a
yeah.
story. You know?
Yes. But as long as you're kind of setting up the same situation.
Okay.
Yeah. So nobody's around. Nobody's given any help of any kind so far. Let's say we're at a high school blood drive and we're packing up all the things, and you walk out into the hallway and you see a high school student laying on the ground. Nobody's around. You know, what do?
Nobody's around.
No. You gotta yell real loud for help, and maybe somebody will come.
I'm about to say, and then I'll call 911.
Well, yes, but you can say, help, I need help, and then
Yeah.
Crystal will appear. Yeah, so there's our scenario, but you've got team members nearby, we'll say that, but nobody like next to the person helping them.
Okay.
How about that?
So if there's nobody next to them, and have teammates around, I'm gonna be already hey, can somebody call 911? And then
So before that, as you like get in the hallway, what do you
I'm
looking
checking for safety.
Yep, there you go, perfect.
And then
Yep.
I'll
Before
yeah.
that, let's start over. Remember our steps. That's okay. So you walk in the hallway. What do?
checking for
Seem to safe.
Yeah.
Yep. Perfect.
Make sure there's no wires or anything.
Yep. Looks good.
Anything that can harm me, that harm them.
Mm-hmm. Then what are we
Then I'm
gonna check?
yell,
Before you yell.
check for responsibility.
Yep. There you go.
But hey, are you okay?
Mm-hmm.
Then I'm gonna yell out. So, can someone call 911, please?
We can. Yep.
I need
Crystal's
help.
on it. Okay.
Then
Then what are you
after
doing?
that, check for
Breathing.
breathing.
Mm-hmm. No breathing. There you go. All right. You do your steps.
For the-
Oh yeah, we'll take off his mask quick. There you go. You have a mask with you conveniently.
So
Take
after-
it away.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I got
Yep.
a mask.
You got a mask. Look at that. You were prepared. Nice.
Back to it.
Mhm.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You can follow along on here.
Oh, okay.
Keep going. Nobody brought your AED yet. There you go.
4,
Here's an AED, but I don't know how to use it.
9, 10.
Remember, we're going to use that right away. Yep. Whether you're on compression number 4 or 5, there you go.
I took that one off.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch
Oh my
patient.
gosh, it's
Oh,
the
clear.
okay.
Clear. Sorry.
That's okay.
Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right.
Perfect. All right, you can turn that thing off. Yay! That's all right. That's okay. I like to do that just because it's a little more realistic.
Unit OK.
Yes, I know. There. You'll have to play with these to really get to know them so you don't mess up like I do. That was great. Make sure you're doing clear when it's analyzing and clear right before you hit the shock button.
Okay.
That was the only thing. Otherwise, your breaths were great. Your compressions were spot on. I saw 2 green lights the whole time. And yeah, your AED was great. Any
I thought that was-
questions?
Why they go a little slower?
It was slow. Yeah, and like I said, those 30 compressions, we want to be between 15 and 30 seconds.
Okay.
So there's a range. And I like to coach people on the quicker end of the range just because you're going to slow down.
Yeah, time out.
This, almost every AED I've run into is on the very slowest end because they want you to be able to do it for a long time. So you can slow down with this. I know the double greens weren't showing up at the same timing as your AED. You can listen to your AED. That's
Okay.
like the one time I'd ignore the lights, go with your AED.
That's what kind of tripped me up
Yeah.
because I was saying that.
No,
I was trying
I
to slow down a
yeah.
little bit, but then I was like, there's a green light there.
So when you're training or teaching this class, just tell people like you can follow the AED, ignore your lights if you're listening to their count.
Okay.
But in general, when we're doing all the other practice rounds, I want 2 green lights because it's on the faster pace,
Okay.
which is the best. But yeah, you did great. No questions?
Let's see this one.
All right.
If this was the
Where
one,
my
I was
pen
getting
went, Miss Crystal?
probably.
And you wouldn't mind filling this out for me, Terrence, so I would appreciate it. Let them know how your class went. Let me know if you have any questions on those.
Okay. Maybe it was just me the other day because this one seemed to go pretty good.
Yeah, the timing and the depth seems good. It's just that we'll try out the breaths on these for tomorrow's class because we got 2 folks in tomorrow's, and I want to make sure that it's working.
Okay.
So when you're doing the skills checklist, Crystal, you can follow along. I've just been doing this for 8 years, so I have it memorized.
Okay.
But it hasn't changed in 8
Yeah, that
years.
was good. That really
So,
helped.
You know, at the point where you say, okay, we're going to do this scenario, then you can look at this and check mark as
He's doing.
he's doing it.
Okay.
So,
Do I have to write?
no, you don't have to write any comments. That's fine. And then you can incorporate scenarios into your class as well if you'd like to. You know, if
I probably will.
yeah,
I
that's
mean,
fine. You know, some people love that. And if you have a class of more than one, those beginning steps I like to do in kind of a popcorn style. Like, hey, Crystal, what's the first step? All right, Terrence, what's the second step? Okay, Terry, what's the third step? You know,
Okay.
and so people kind of get an idea, and then it encourages participation. And it's the beginning steps that's hardest to remember.
Okay.
You know, the compressions and breaths, everybody knows that's a part of CPR. But yeah.
That was pretty good.
Good. See, and
Yeah.
it doesn't take too long.
It
really.
doesn't.
It's
And
very much about, you know, how much practice they want.
definitely, I do want to come to tomorrow's also.
For sure.
I just think that this is kind of like not far and few
Right.
that we're able to do this. I was just telling Gabby that I was excited about the class because it's better when we can see someone execute it first.
Mm-hmm.
So yeah, this is
Yeah.
really good.
Good, good. I know for tomorrow's, I'm going to see if Terry or Marlene can sit in.
Yeah, I think that would be good for
Thank
them.
you.
Because I didn't know
Appreciate
if they
it.
was gonna be able to attend. That was one reason why I recorded
Mhm.
this.
Oh,
So I'm
you can throw away the blue one. We're going to bleach the